Hey friends, welcome back. In today's video, we are gonna take a look at David Beckham's hair throughout the years and we'll try to understand what he has done to fight hair loss. Let's go back to the year 1996. At the age of 21, it is well known that Beckham has a prominent widow's peak. Additionally, his facial proportions are good with nearly equal horizontal thirds. As with the middle and lower thirds, the top third is basically the same as the middle third. Now in 1997, at the age of 22, Beckham did not have any major changes with his hair. This is the same in 1998 and 99. However, in the year 2000, at 25 years old, there occurred an interesting type of phenomenon. He has this horizontal bony prominence right at the coronal suture line. This is interesting as it might either be a mild or late form of craniosynostosis. This is a medical condition that manifests as fusion of the cranial bones. This is not usually seen in adults, but to notice something that looks like what David has, it shouldn't really have anything to do with hair loss, but it is still important to know. He also has early signs of frontal temporal recession, as you can see in some of his photos, and you can see more of a scalloping on his right side compared to the left. In 2001, at 26, there were no changes seen. In 2002 to 2003, all he had was a really cool haircut, so there were actually no noticeable changes here. However, in 2004, at the age of 29, no transplant surgery has occurred as far as we can tell. It would have likely been an FUT approach if any, so that would give it a more concealed look, given the popularity of that type of transplant at that time. But again, for Beckham, no signs of transplant were actually noticeable. In 2005 to 2008, no changes were noticeable, but at the age of 33, he was already probably in some sort of medical therapy to combat hair loss. What is recommended is a dual modality therapy, and most patients start with the first-line type of treatment, which is propecia. Finasteride is its generic name, as well as the more famous minoxidil. In fact, the first-line treatment for hair loss in men for androgenic alopecia is finasteride and minoxidil. There is also a topical formulation of this medication, which is Rogaine, but it is also available as an oral form, which is minoxidil, taken once a day. David Beckham must have taken a combination of those medications. He might also be using a laser light cap or maybe some microneedling. He might also have taken platelet-rich plasma therapy as well. At the age of 38, there is a noticeable form of camouflage in the hairline, so he might just be using some sort of makeup done for his photo shoot to make him look like he has lots of hair, or fibers might have just been used. When you look at the left temple and compare it to the previous photos, you can see a return to baseline that comes after this year. So in 2014, we are not seeing any form of camouflage anymore on the temple. In 2016, at the age of 41, there were still no signs of transplant, but here's the thing. Normally, the first few rows of hair in natural hairlines has finer hairs, and in transplant, we try to recreate that by putting single hair grafts right at the hairline for the first 2 or 3 rows. This is important because, as you can see in Beckham's hairline, he has finer hairs for almost 5 mm to a centimeter, and then it starts to blend into thicker hairs. Fibers might have also been used here, but a natural progression still gives it a naturalness, and this is the goal of surgery. There is an irregularity to the hairline and a quality to this where there are micro and macro irregularities. So a sawtooth appearance is seen here, even in areas where it's more straight. The hairs that are more irregularly placed are the micro irregularities. In 2017, at the age of 42, there is frontal temporal recession. This continues especially on the right, and compared to his photos in 2001, you can look at his birthmark there and his right temple. It is noticeable that it used to be covered more with hair, and in 2017, there is not really a lot of hair in that area. That is an additional sign of hair loss progression. But at 42, it is still remarkably stable. In 2018, at the age of 43, Beckham started to close the corners here by using posterior temporal hairs. So as he uses a comb to throw them forward or down, that helps to camouflage the corners so it doesn't look so recessed. At 44 years old in 2019, he must have been using fibers to close down the corners. His right corner has a more rounded and well-formed appearance because of the use of that camouflage. This is actually very distinct here, especially because he does not have much hair to cover it. He then uses the camouflage to cover the rest of the scalp. He has enough hair in that area to make the whole appearance just look thicker. this is so people can't tell that fiber or camouflage was used. Back in 2020, one image that was released in the tabloid showed Beckham's short haircut, and it exposed some of the scalp show, and you can already tell the difference in hair density between the DHT sensitive area and the resistant zones, which line the side of the head and the back. But no evidence of hair transplant is noticeable. It looks like as he grows his hair out, he showcases healthier hair which is thicker, and he is also able to use the fibers to increase the appearance of its density. In 2021, at 46 years old, the use of fibers is still continued, and his surrounding hair is used to conceal the recessed corners. Now in this year, 2022, no further changes are seen in David Beckham's hair. Well, that's about it for this video. If you have any questions, feel free to comment down below. If you want to learn even more about health and fitness, be sure to turn on your bell notification so you get updated when we post new videos. If you like the video, please click the like button and share it with your friends. You can go ahead and click the subscribe button as well because we have tons of other videos in our channel that we think you'll enjoy. Thanks for watching, and we'll see you in the next video.